The first week I treated 2 sets of stifles, I treated a deep digital flexor, I treated two proximal suspensories in the first week. Those are some pretty ugly injuries, right? And so I just was like, if it's going to work, we're going to find out. And I feel like the ProVet gives us really good results. My name is Chad Hewlett. I am an equine practitioner in Airdrie and Dwenton, Alberta. And I've been practicing in this area for almost 25 years. Basically, my practice involves the examination of athletic individuals, the proper diagnostics, treatment, follow-up, and the rehab of only equine athletes. Over the years, being open to how medicine does evolve and it's not so dogmatic, I have paid attention to that and how we've changed with the PRP, because you do get that benefit of having those white blood cells in there, and it's finding the right mix. And I feel like that's where we're at now. The ProVet has definitely worked its way into our practice from the standpoint of a few things. Being able to use something directly on farm, in clinic, and having the comfort and confidence to be able to know that you're getting a sterile product. As far as the white blood cell component, ProVet does have that. I think that's a benefit in the sense that it does stir up the environment a little bit, get some healing to happen inside of there without causing moderate to severe discomfort. I think it's a novel technology in the sense of like vertical centrifugation. And when you look at the research that has been done with this particular centrifuge, it's like you have less damage to that soup. The healing factors that this particular product helps us concentrate are really what we're looking for when it comes to therapy. For us, just the size, I mean, I keep holding my hands like this because this is the size of the centrifuge, right? Usually the centrifuge is this size, right? Whereas with this little guy, it's like, you know, when you're in the barn and you're doing stall site treatment, you would love it if there was a nice lab there, but sometimes it's a washroom, right? Sometimes it's like the countertop table or the particular tray that we take with us. You know, the stand's about this wide. So it allows us to have the sterile field and the centrifuge on there all at once, right? As a medical professional that is a doctor, so to speak, I enjoy when I can do my diagnostics, look at the patient, spend time with the client and discussing things, and having the confidence to push this to an animal health technologist who's licensed and can do all these procedures. I don't watch my tech. There's no involvement with me until the needles get stuck in at that point, right? And then it allows me to work on my medical notes, talk to the client, do other things that need to be done. And so this product really gives great benefit to that. We find that from diagnosis to treatment, you know, we're about 35 minutes and we're done. Client is back on the road. I mean, like it or not, in clinical practice, you need flow, right? Like if you're only seeing 2 or 3 patients a day, you're going to be charging quite a bit more money than the person that's seeing 10 a day, right? And in our situation, I'm not ready to see 2. I want to see 10 every day, right? And so this allows us to stay inside of that realm.